Public health experts have been urging travelers to check their immunization records before taking flight this spring and summer. For that and more travel advice, let's discuss with Dr. Matthew Tenenbaum, the Associate Medical Officer of Health in Wellington, Dufferin, Guelph. Dr. Tenenbaum, thanks for your time.
Thank you for having me today.
Okay, I want to start with the measles outbreak because we've been following this and the continued spread across southern Ontario. What are you recommending to those who are planning to travel this spring? What can they do in order to ensure not only their protection, but also that they're not bringing the virus back with them?
Absolutely, and I want to emphasize that ordinarily we think about measles as a virus that you can get from travel and bring back to Canada or Ontario, but what I'm going to share applies equally well to people who are staying within the province. We are in the midst of a significant measles outbreak. I know we've now crossed 1,000 measles cases across Ontario, which is really unheard of in terms of the scale and scope of this, looking at recent decades. So measles is here in Ontario as well as abroad, and the most important thing people can do is check their vaccine records. Most people who are young enough would have gotten 2 doses of measles-containing vaccine. Ordinarily on vaccine records, that will be listed as MMR or MMRV. If you're not sure about whether you're protected, of course, contact your doctor or your healthcare provider. But I want to emphasize that getting vaccinated is the most important protection you can have. And people who have had 2 doses of vaccine are 99% protected against measles, even if they were to encounter someone with the illness. So getting vaccinated is the most important thing you can do right now.
Okay, let's talk about health insurance as well. How important is it to have it before you take flight or to make sure that you have some kind of travel insurance?
But I think it's important that as you're planning to travel somewhere, whether it's for work or vacation or anything, it's important to think about what could happen while you're abroad. We often think about vacations as relaxing or filled with activities that we choose, but we know that every year people go abroad and they injure themselves or they have an underlying medical condition flare up or something else happens to them which makes them sick or gives them an injury, and it's important to plan for that possibility just to make sure that you're not stuck in a very difficult position having to access healthcare services in a foreign country without support. So definitely think about your own vulnerabilities, your own health status, what your travel plans are, where you're going, etc. Maybe talk it over with your family doctor, but think about what you might need while you're abroad and make sure you have a plan for that, which can include health insurance as one of the layers of protection.
Okay, for those who haven't booked travel yet, but maybe they're planning to take a late spring trip or an early summer vacation, do you have advice on how to assess travel risks before actually choosing your destination?
Absolutely. So as you're thinking about where to go, one really good resource you can use is to go to Travel Canada, travel.gc.ca. They actually have an index where they have alerts and advisories and information country by country, including about health risks as well as other risks you might face like violence or crime or theft. So using that can really help you plan for your trip and help you think about the kinds of things you need to prepare for. Certainly, they will list health risks in those advisories, which might, depending on where you're going, give you information about how you want to plan your visit or whether you need to see someone for pre-travel vaccines or other protections. It really does vary a lot where you go, depending, like the risk profile varies a lot depending on where in the world you're traveling. And it's important to make sure you're thinking about those health risks and other risks as you're putting together your plans for your trip.
Okay, that's great to know. I know we touched on measles and protection. How can people ensure they're protected from other viruses or diseases, like mosquito-borne diseases, while they're on vacation?
So in general, for diseases, speaking broadly, making sure you're up to date with whatever the recommended vaccines are for you and your age is important. Ordinarily, you don't have to worry about it, but if you know that you're overdue or that you haven't gotten some of the vaccines that are recommended for you, those are things that are worth doing. That's generally good advice. As well, there are particular vaccines that may be required or recommended depending on where in the world you're traveling. For example, if you're traveling to parts of the world where yellow fever is a risk, many of those countries actually have requirements that you have evidence of being vaccinated against yellow fever. There are other travel vaccines that may apply, but again, that's very destination specific. As well as, think about as you're putting together your plan for your trip, think about what your activities are going to be. If you're planning to be outdoors a lot, if you're planning to do things like hiking or being in the bushy areas or in forested areas, you might be exposed to things like ticks or mosquitoes in the course of your activities. Some of the guidance that applies locally about protecting yourself against those things also can apply abroad, making sure you're using insect repellent, making sure you're covering up exposed areas of skin, making sure you're doing skin checks for things like ticks after you're done your activities. Those are generally good practices that can, be applied while you're traveling as well. And again, there are some considerations if you're traveling, for example, to parts of the world with malaria. You might get travel advice specific to those destinations.
Yeah, I mean, it's really good advice, and it really stands for year-round travel as well. Dr. Tenenbaum, it's timely. Thank you very much. Dr. Matthew Tenenbaum is the Associate Medical Officer of Health in Wellington, Dufferin, Guelph. Appreciate your time.
Thank you very much.